Hi, I am Dr. Vishnuvardhan. I am consultant nephrologist at Manipal Hospital Whitefield. Regarding systemic hypertension, this is one of the most prevalent disease and it is one of the silent killer. It is the hypertension which leads to heart failure, kidney failure or peripheral vascular disease or stroke. Hypertension is a very silent thing. It may give you mild symptoms like headache or weakness. So once we diagnose, if we treat it properly, we can reduce the incidence of heart failure, we can reduce the incidence of stroke or peripheral vascular disease or kidney failure. That it is a preventable, means we can prevent the complications of systemic hypertension. One more thing here is systemic hypertension may be essential hypertension, means that is as part of your genetic composure or part of the age or without any secondary disease. There may be hypertension that is called as essential hypertension. But there are some cases are there where there is a specific disease which is causing systemic hypertension. So that is called as secondary systemic hypertension. If I treat that disease specifically, we can completely clear the systemic hypertension. Meantime, kidney is the main organ behind the systemic hypertension, and kidney disease may be inside hidden and that is presenting outside as systemic hypertension. So screening of the kidney is one of the essential component of diagnosis and treatment of systemic hypertension. So if we identify hypertension early, we can identify the kidney disease also early and we can treat the kidney disease also early. One more thing for general public, my advice is systemic hypertension is preventable. The main reasons are overeating, obesity, excess salt, smoking and stress and lack of exercise. So I want you to implement the exercise, low salt diet and also avoid excess food intake, these things, so that you won't develop hypertension. So first you try to prevent systemic hypertension. By chance if it's not able to prevent hypertension, please come to us. Let us diagnose whether it is essential or secondary hypertension. If secondary hypertension, let's treat the reason behind the hypertension and you get cleared of the hypertension. And if it is essential hypertension, let us treat that adequately with a great number of good medications are available. With that, let's prevent the secondary complications of hypertension.